In the course of this recording, you will learn about the types of clinical questions one must ask when engaging in evidence-based practice. You will also learn about how to formulate a good clinical question. And the inquiry process. It is the very beginning of the process. It is highlighted in the diagram. You will notice that when you identify a problem and formulate a question, it is a process and will entail you examining internal and external data sources, as well as resources at your organization or institution, like colleagues and in-house experts. Before you can ask an effective clinical question, you need to identify a problem. Many times, individuals are unsure where to start or what is a good source for a question. Sources of questions are many. Some places you may want to look to are safety notes, where adverse events have been noted, events on the unit, hospital data, or hospital or unit goals. These hospital or unit goals are especially important because they are what many in the hospital are focused on and usually identify key problems that need to be addressed. Each of these, or any of these, are good places to start when it comes to trying to identify a problem from which you can generate a clinical question. Ask a good clinical question is because finding evidence is like finding a needle in a haystack. In recent years, there has been a sharp increase in the amount of evidence or data that's available. In order to access this data, a good clinical question will be needed. A good clinical question will do three things for you. First, it will give you focus and prevent you from allowing extraneous information to distract you. Second, it will allow you to be efficient as you search the databases and other resources for evidence. Third, it will allow you to effectively communicate with your colleagues as well as interdisciplinary team members about their problem you are attempting to solve. Question and the problem you want to address, you may want to consider four things. First off, is your topic or problem one that causes great harm or is of great importance to the unit or organization? This is especially true when your problem that you want to solve is not something that clearly aligns with hospital goals or unit goals. A second thing you may want to consider is cost. If the intervention or solution that you are aiming to come up with is one that's too costly, you may not be able to implement it. Or the cost of what is going on, the problem, in reference to the organization may be so great that it's telling you that it is a very important problem that you ought to address. A third thing is feasibility. Is your question or problem something that's feasible for you to solve, especially as it pertains to nursing scope of practice? There are many problems out there that nurses will look to solve that are not within their scope of practice and are much harder for them to change. And so if it is something that's not within the nursing scope of practice, it may be a good idea to either rethink your topic or problem, or make sure that you have the interdisciplinary team members on the team as it becomes to the evidence-based practice initiative launch and evaluation of the evidence to ensure that you're able to solve that problem. A fourth piece is availability of resources. If the test or intervention is not something that is available, or if there's not enough manpower in order to address that problem, you may be wasting your time, at least at this point. Please proceed to the second part of this presentation, which is in a separate video.